Yeah, you can start.
Yes, sir. Good afternoon, sir. Myself, I'm Bandari Chandana. I'm from Jagitial. I have completed my PharmD from Vagdevi Pharmacy College from Warangal. Sir, next slide. Here my topic is adverse drug reactions from herbals and nutraceuticals. Now I'm going to give demo presentation on ADRs, adverse drug reactions from herbals, and how the ADRs are occurring, and what are the examples, what are the consequences for people are facing from herbal and nutraceuticals. These are the pictorial image representation of the herbal products and nutraceuticals. Next slide, sir. These are the content what I have included in this demonstration. Firstly, main about the adverse drug reactions and pharmacovigilance, herbal and nutraceutical products, and introduction to the topic, and how the global market is there about these topics, and why areas are occurred and how the areas are occurred, what are the mechanisms of areas, and the examples of herbal products and nutraceutical products. Next slide, sir. And the area reporting systems and casualty assessment tools to assess the area capacity, and the MEDRA, and the case reports in literature, and what are the clinical challenges, and what are the regulatory complaints, and what are pharmacovigilance system, and the strategies to minimize the areas, and the future perspectives of the areas, and the overall about the area. By the end of the session, got the knowledge about the how areas are occurred in herbal products and nutraceutical products, how to minimize that areas, and how to report that areas. Next slide, sir. Firstly, what is ADR? ADR is an harmful and unintended effect of a drug or a herbal product, nutraceutical, which occurs at the normal therapeutic dose, and it's not related to the overdose or misuse or medication error. Basically, normal adverse drug reaction definition, there is no about herbal product and nutraceutical. My topic is about nutraceuticals and herbal product. That's why only I added here herbal products and nutraceuticals specifically. It is only the unintended effect of the drug at the therapeutic dose, not related to the overdose or misuse or anything. There are different types of ADRs, and they're broadly classified from type A to type F, that are type A, type B, type C, type D, type B, and type F. These are some examples of ADRs. Kava is an pipermethysticum. It's an herbal product. While over using of this product leads to the hepatotoxicity. Hepatotoxicity means liver damage, and this is the herbal product example ADR. And the iron overstimulation or overusage of iron product leads to the GI upset and constipation. This is the nutraceutical product. It's a warfarin. Warfarin will cause bleeding. This is a normal pharmaceutical conventional drug example. These are this is the what adverse drug reaction, and the what type of reaction, what examples. Next slide, sir. Since ADRs are the major concern for patient safety, and then monitoring is done by using the pharmacovigilance. ADRs are most of the people are facing ADRs nowadays, but there is one system that is called pharmacovigilance. We have to report the ADRs to the pharmacovigilance here, but most of the people don't know about this. And here, what is pharmacovigilance means? Pharmacovigilance is a branch of medicine and the science and activities related to the detection, assessment, and understanding and reporting of adverse effect or any other possible drug related problems to that system. It's complete reporting the authority. It's a adverse drug reaction monitoring center. It will maintain a VG base. It's a world largest database they are using. Next slide, sir. Coming to herbal products, herbal medicines are therapeutic products which derived from the plants. Plants' roots are leaves, seeds, flowers, extracts, and these are used to prevent or relieve treat health conditions. They may use it as a traditional medicine or as a dietary medicine. Uh, these these plant derived products so many members are using nowadays. And the examples of the herbal product is aloe vera. Aloe vera scientific name is an aloe barbadensis miller. And the turmeric. Turmeric scientific name is curcuma longa and ginkgo biloba. These are the herbal product examples. This aloe vera is used for the skin health and it's used in cosmetics preparations. And the turmeric is act as an anti-inflammatory and antioxidant. And the ginkgo biloba is used as in brain and memory problems. Next slide, sir. And coming to nutraceuticals, the nutraceuticals are next generation of health and wellness of products. And the nutraceuticals are food derived products. What I said, herbals are the plant derived products, and nutraceuticals are food derived products such as vitamins, minerals, amino acids, probiotics, and functional food. Vitamins like vitamin D and vitamin A, vitamin B, and the minerals like calcium, phosphorus, and the amino acids like trypsin, histidine, and probiotics, yogurt, functional foods like oats, soya, fish, and these are having more health benefits, but also is having ADRs. And the examples of the nutraceuticals are omega-3 fatty acids. Omega-3 fatty acids are like fish, flax seeds, fish oil, and the probiotics. Probiotics, yogurt, or pickles, and vitamin D supplements like vitamin D2 or D3. It's available in tablets, capsules, and drops in many formats. Next slide, sir. Coming to the introduction of the ADRs from herbals and nutraceuticals. Firstly, herbal medicine and nutraceuticals are widely consumed worldwide as alternative to the supplements of conventional therapy. Most of the members are using these herbal and nutraceutical products in this generation, but by using this, it's an alternative to conventional therapy. Conventional therapy means conventional drugs like warfarin, aspirin, or pharmaceutical drugs. Conventional therapy means, and they are often perceived as natural and safe. Most of the members are thinking that these drugs are natural and safe. However, these drugs are also having some areas. However, pharmaceutical drugs, these can cause adverse drug reaction. It's ranging from gastrointestinal disturbances to severe hepatotoxicity, neurotoxicity, cardiotoxicity, and life-threatening conditions like hypersensitivity reactions. Life-threatening hypersensitivity reactions means it's a medical emergency. It's most commonly it's an anaphylaxis reactions, a rapid or generalized allergy reactions that can fatal without emergency treatment, immediate treatment. The hepatotoxicity means liver damage, and nephrotoxicity means kidney damage. Cardiotoxicity means cardiovascular health, heart-related issues, and many of the people are facing this type of areas. The lack of the strict regulations and variability in formulations and drug heavy interactions increase the risk of areas. Means the lack of strict regulations means lack of regulatory complaints, and variability in formulations means there is a difference between the final product composition and standardization or bioavailability changes, and drug heavy interactions like if suppose a herbal product is ginkgo biloba with warfarin, it increases the bleeding. Ginkgo biloba shows antiplatelet activity. Warfarin is given to prevent the blood clots. If suppose a patient is taking one medicine from ginkgo biloba from herbal medicine and one from conventional medicine like warfarin, it's a chances of getting of increasing bleeding conditions. Most of the people don't know about this. Most of the people are using both the drugs at a time. Many of the people are getting interactions, drug interactions, adverse drug reactions, and many changes in their metabolism, everything. This is complete. This is a normal and conclusive introduction means uh, people are thinking herbal and nutraceutical medicines are safe, but these medicines also having adverse drug reactions like pharmaceutical drugs. Next slide, sir. In global context, in global market, the World Health Organization estimates that 80 percentage of the world's population relies on herbal medicine only as some part of primary health care because of it's easily available in rural areas. So most of the people are the thinking primary treatment is an some leaves or some herbal products they are using for their routine normal problems in villages primary health care. In India, Ayurveda, Siddha, Unani are widely used in nowadays. In China, traditional Chinese medicines are integrated into healthcare present situation. In global market, nutraceuticals are most widely used. In global nutraceutical market is now growing rapidly. It's expected to be surpass US dollar 600 billion by 2030, but safety evaluation is less stringent than for pharmaceuticals. Pharmaceutical drugs having some evaluation criteria, preclinical trials, clinical trials, but most of these herbal products are skipping preclinical trials or post-marketing surveillance studies. There is there is no regulations like pharmaceutical regulations is there, but not widely using the regulations. The global market is now widely using nutraceuticals for weaknesses like vitamins or something, or they are using everywhere. Next slide, sir. Actually, it's why ADRs are occurred in herbal and nutraceutical products. In conventional medicines, ADRs are occurred due to the some interactions and some long-term exposure like that. Why ADRs are occurred in herbal and nutraceuticals means due to the lack of standardization procedures. Different brands have variable concentration of active compounds. Yeah, in herbal and nutraceuticals preparations, there is a lack of standardization. They are not standardizing with standard drugs. These they are using different brands, so this leads to a one complication and contamination and adulteration. Many of the products are contaminated nowadays. It's contamination, maybe it's unintentional, but contaminating with like heavy metals or pesticides and the adulteration. Adulteration is the major thing nowadays everyone is facing, and every pharmaceutical companies or everything in conventional medicine also adulteration is major criteria. And the heavy metals, pesticides, and hidden pharmaceuticals, they are adding to the some products, herbal products. If suppose, for example, for diabetics, we are using metformin. Metformin is adulterated with the herbal products. This is one example for that. And the NSAIDs, painkiller, NSAIDs are used for pain. Now that painkillers are also adulterated nowadays. And metals like lead, arsenic are adding, and the pesticides like organophosphates, pyrethroids. These are using nowadays. So, because of this contamination, adulteration, many of the members are getting adverse drug reactions. And next, coming to drug and herb interactions, how the drug and herb interacts. And herbs can induce or inhibit cytochrome P450 enzymes. It's altering drug metabolism. If patient is using one drug and the one herb, due to these both where there is some changes in the body and they are getting adverse drug reactions. For example, if patient is having the herb from ginkgo biloba and the drug like warfarin, both can increasing the bleeding tendency. This is the major problem most of the people are facing. And because of high dose or long term use, high dose like long term use, and many of the people are using vitamin supplements nowadays. Prolonged use of that vitamin supplements can lead to the toxicity. This leads to the ADRs. And then individual variability means based on person. Individual variability like age related or genetics or family history, or if patient is having any past history diseases factors, these all are influenced to the ADRs levels. From In past situation, patient is having some diseases and patient is using some medication, and now they are taking herbal and nutraceuticals. Because of that medication and this medication, patient can get more interactions. Next slide, sir. What risk factors are increasing the areas you are thinking? It because of elderly patients. Elderly patient having the sir before slide. Sir before slide. Elderly patients. Elder patients is having physiological functions are different from adults. Adults is different from the elder population. So elder populations are taking medications, but their metabolism different, their absorption is different, their body physiological function is different from adults. So they are getting more chances of getting ADRs. And due to the polypharmacy means usage of multiple medication at a time. If patient is using one medication for one disease and one medication for the other disease, because of this using multiple drugs, this because of this polypharmacy, patient elderly patients are getting more ADRs. And in pregnant women mostly in earlier generation teratogenic effects. It's a harmful effect on the developing embryo or fetus. It's caused due to the development. It will cause birth defects and development abnormality, and growth of the fetus is restricted due to the thalidomide. This thalidomide in pregnancy, they are prescribed for the morning sickness. Because of the drug, they are used. Where the drug was used, the drug many of the patient leads to the focomelia, uh, limbs deformalities, and these are the pregnant women are facing. And where this stage only pharmacovigilance came into evaluation, and pregnant women also more risk to the ADRs because of these drugs or any other drugs. Not only thalidomide, there are different drugs also available. In children's also getting it more because of immature metabolic system. Children's are slowly growing up now. They are not completely mature metabolic systems or immune systems. Because of that only they are getting. And the risk of overdose means in children's, in pediatrics, we are prescribing dose of the drugs like based on the patient age and the patient weight now. Because of this small minor dose mistake also can lead to the ADR. Then next, immunocompromised patients. Immunocompromised patient means patient having weak immune system. Because of that weak immune system, patient when taking the probiotics may can cause sepsis. Sepsis means it's type of infection, widespread of the infection total overall body. Because of weak immune system, they are get infected. Infections are more occurred in these conditions. And chronic disease patients may worsen their condition because patient already having some disease and patient is have already having using some medications. Because of the in this condition, if suppose patients are using some herbals or some nutraceuticals, because of the previous medication, they will get interactions or ADRs. These the overall risk factors are increasing nowadays for areas and most commonly elderly patients, pregnant women, children, and immunocompromised patients and chronic disease patients. Next slide, sir. Now we explore the mechanisms, how the ADRs are occurred from herbals and nutraceuticals. Uh, First one is pharmacological and dose-related effect. Due to the intended active constituents means it's like same conventional drugs. If suppose patient is taking any drug, it means some minor dose change also patient can get ADRs. If suppose for example green tea extract can lead to the hepatotoxicity at the normal level, low concentration of catechins, a patient not getting any ADRs, but at high concentration of catechins, patient will get interactions or adverse drug reaction. It's related to the dose, low concentration, high concentration. Because of pharmacological action, this dose relation, patient will get ADRs. And the next mechanism is an idiosyncratic or immune mediator reactions. These are totally unpredictable. It's not related to the dose, not related to the disease, it's not related to the drug interaction or not related to anything. It's unpredictable. For example, kava, it's a herbal product. It getting the idiosyncratic hepatotoxicity, liver damage of the patient will occur by using the kava. Next, Ishnasa, it's a allergic reaction will happen with this herbal product. And next, third one is herbine drug or nutraceuticals and drug interactions. Because of these interactions, also patient getting ADRs. In this metabolism and clearance of the drugs will alter, and the conventional drugs bigger. These herbs and nutraceuticals are interacting with conventional drugs, and the patient is getting drug interactions and the adverse drug reaction. If suppose patient is taking atorvastatin drug, if suppose patient take also patient taking grapefruit juice, both can uh, both can increase the toxicity of the statins. Atorvastatin isn't statin. Because grapefruit juice it inhibits the CYP3 A4 enzyme, then it will increase the toxicity of statins. Because of like these mechanisms, ADRs are occurring in population. Next slide, sir. Next, contamination and adulteration. These are the main criteria for the getting an adverse drug reaction. Contamination means presence of unwanted or harmful or unintended substances in the herbal and nutraceutical products due to the poor quality control. These are it's not intentional. It's because of the manufacturing process or anything. It's because of that contamination. And the adulteration is it's an intentional addition of substance to the herbal and nutraceutical product to enhance the drug effect and they lower the cost and mimic the standard medicines. For example, contamination is due to the some manufacturing process or some criteria in the laboratory, but in adulteration is intentionally adding some substances to the herbal and the nutraceutical product to their benefits. For example, herbal tea is contaminated with organochloride pesticides. It's detected in Europe. Because of this, long-term liver and kidney toxicity was occurred. Many of the patients. And for adulteration, some herbal pain relief capsules are adulterated with indomethacin. Indomethacin is an NSAID. It's a pain reliever. Na? Herbal pain relievers also pain reliever. Na? They don't know about this. This na, that's why only herbal pain relievers adulterated with NSAIDs. This leads to the gastrointestinal bleeding and kidney damage and the misidentification and substitution of plants. Substitution of plants is this plant species is used. This leads to the unexpected toxicity. For example, Aristotelia fangshi, it's in Chinese hair. It leads to the hepatotoxicity and urethral cancer. Mm. This substituted in the Chinese countries. This leads to the nephrotoxicity because of this misidentification or substitutions. Also, many of the areas are getting nowadays. Next slide, sir. Next is an organ specific toxicity. Organ specific toxicity means it's related to the organs. Organ it refers to an harmful effect caused by the herbal and nutraceutical products that selectively damage particular organ or systems. These are only focusing on some organs and that leads to the damage of that organs. Hepatotoxicity means it's a liver damage due to the kava, green tea extract or black cohosh. And the nephrotoxicity, it's a kidney damage due to the due- kidney nephrotoxicity means kidney damage. Kidney damage is due to the aristalgia and heavy metals like containing herbals, metals like lead, arsenic, or cardiotoxicity means heart-related problems. It's due to the ephedra. This ephedra is banned in 2004. Neurotoxicity. It's a neurotoxicity is due to the nutmeg. It's in seeds of the one plant. It's used for the because of hallucinations or seizures. The This neurotoxicity is occurred. Then next coming to the nutrient and nutraceutical interactions. These interactions also leads to an ADR, excessive supplementation or imbalance or toxicity. This excessive supplementation of nutraceutical product can lead to the toxicity, and this leads to the ADRs. For example, it's an vitamin A is a nutraceutical. It leads to the hepatotoxicity because of excessive supplementation and teratogenicity at high doses. If suppose patient is taking vitamin A capsule and the patient is eating carrots or fish or egg or some vitamin A products, because of this also patient is getting ADRs. Unintentionally they are getting ADRs, but they don't know about this. But most of the people are getting this like this ADRs. These are the seven mechanisms how patient is getting ADRs from herbals and nutraceutical products. Next slide, sir. Here, there are some examples of ADRs from herbal products. Herbal products is an aloe vera. Aloe vera scientific name is an Aloe barbadensis miller. Its a common name is an aloe vera, aloe and gritukumari. It's a traditionally this used as an laxative and wound healing. And but it is having areas like diarrhea, electrolyte loss. The herbal product is ginkgo. Scientific name is ginkgo biloba. Common name is made hair tree, and the traditional it's a traditionally used for the memory booster. It is having areas like bleeding, and it is having drug interactions. I said before, drug interaction with warfarin. And the herbal product is an kava. Kava scientific name is fiber methistica, and the common name is kava, and the ava also using in some countries. And traditional this used for the anxiety relief and relaxation, and it is having areas like hepatotoxicity, liver damage, and some another herbal product is Saint John's wort. Its scientific name is Hypericum perifortum, and the common name is the tip down sweet. And the traditionally it is used for the mild depression and mood enhancer, and it is having areas like drug interaction and photosensitivity, and for like hypersensitivity reaction when the patient when the person is taking this medication, and when outside for the light sunlight they will get photosensitivity, and it is having some drug interactions also. And the hair ephedra. Ephedra, scientific name is an Hepidra sinica. Its a common name is mahung, and traditionally it is used for the asthma, weight loss, and stimulant. And it is having areas like hypertension, arrhythmia, stroke, arrhythmias like irregular heartbeats, like in suddenly getting more heartbeats or less heartbeats like this. These are some examples of herbal products, ADRs. Most of the herbal product is having ADRs. Next slide, sir. Next slide, sir. Examples of areas from nutraceuticals. Nutraceutical products also having areas, vitamin A, vitamin D, and the vitamin D is fat soluble vitamins, and vitamin A is commonly used for the vision, immunity, skin health, and vitamin D is used for the bone health and calcium absorption. But is having areas. Vitamin A is having hepatotoxicity and teratogenicity at high doses. And vitamin D is used for bone health and calcium absorption, but it is having a hypercalcemia, increased calcium levels, and in kidney stones at excessive intake of vitamin D. And omega-3 fatty acids, it's these omega-3 fatty acids are available in fish oils and flax seeds oils. It's commonly used for the cardiovascular protection, but it's having areas. It's bleeding risk at high dose and arrhythmias. Protein supplements like whey, soy, casein products. These are commonly used for the muscle building or nutritional support. Most of the sportsmen are using these protein supplements, and they are getting ADRs like renal strain and worsen the if long term usage means if patient is may worsen kidney disease also. And the iron supplement is a fortified foods or iron salts. It's all available. It's available in tablets, capsules. It's commonly iron supplements commonly used for the anemia and in prevention. Some anemia prevention treatments also it's using. And ADRs are long-term usage leads to the ADRs. That ADRs are gastrointestinal upset and constipation and poisoning in children also. Next slide, sir. These are some common examples. And the herbal and nutraceutical product is having therapeutical benefits and adverse effects. Here most of the products is there. These therapeutic effects like diabetes, in obesity, in dementia, or in many diseases, our herbal product is having therapeutic effects. As usual, they are having that product is having adverse effect also like cytotoxicity, carcinogenicity, hepatotoxicity. Most of the drugs having therapeutic effects and adverse effects like conventional drugs. Next slide, sir. ADR, now coming to ADR reporting. Most of the people are getting ADRs, but they don't know how to report the ADRs. ADR reporting system is available in every country according to their rules and regulations. Here, pharmacovigilance system is there to report the ADRs, but everyone should report the ADRs. Means many of the people get awareness about the ADRs, which product is getting a occurring adverse drug reaction or drug interactions. ADR reporting system. First, in ADR reporting system, first we have to identify the suspected drug, which drug is causing the ADR from herbal, nutraceutical, or conventional drug. Any drug, it's the same procedure for every drug. And the first step is to identify the suspected drug, which drug is causing ADR. If suppose patient is getting skin rash, you have to identify that drug, which drugs a patient is taking in these drugs, which drug is having high chances of getting that skin rash. First identify the suspected ADR, then document the details like patient details, patient demographic details, and patient when the patient is started that therapy, and when the patient is getting that ADRs, and when the drug was stopped. We had complete details about the that ADR, when it is started, time, day, date, everything is important in ADR reporting. When ADR form is there, in that every details to fill the form. Next, third step is fill ADR reporting form. After, if the drug suspected drug is there, complete details of the drug is there, means then proceed to next step. It's a fill ADR reporting form. It's available in website. They have to fill that forms according to their rules and regulations. Whatever the given in that form, we have to fill according to them, and that we have to submit that form to the National Pharmacovigilance Center in India. PVPI, Indian Pharmacovigilance System. We have to submit to PVPI. Then that data is sent to the WHO UMC. UMC means Uppsala Monitoring Center. It's World Health Organization. It's an international adverse drug reaction monitoring center. It's there in Sweden. PGBase is the main database. It will maintain data related to the ADRs. It's the largest database in the world. First, identify the suspected drug, then document the complete details of the drug and the adverse drug reaction, and fill the form and submit that form into the PVPI, and then the data is sent to the UMC, Uppsala Monitoring Center. It's a actual center. It's located in Sweden. Next slide, sir. ADR reporting systems. Internationally, is available in an WHO UMC. It's an Uppsala monitoring center. It's located in Sweden. It will maintain the VG-base. It's a global database for ADRs. And in India, PVPI, Pharmacovigilance Program of India. And for particularly for herbal and nutraceutical medicine, pharmacovigilance program for ASUH drugs is available. Means Ayurveda, Siddha, Unani, homeopathy. For all these drugs, pharmacovigilance program for ASUH drugs is available in India, and most of the people are reporting also. In for US, FDA, MedWatch, Food and Drug Administration, MedWatch, and for Europe, Udra Vigilance. Europe regulation EMA means Europe Medical Agency. These are the ADR reporting systems available for the country wise. We have to report the ADRs through the form, or mobile apps also available to register to report the ADRs. These are many processor, many possibilities are there to report the ADRs. Next, sir. Next slide, sir. Here coming to the casualty assessment. Causality assessment is for measuring the adverse drug reaction, how it is, how it's probable. It's based on some criteria. We are by using some scales. We are assessing the patient by using the scales. Next slide, sir. Next slide, sir. Causality Causality assessment tools and scales are used for herbal and particularly for herbal and nutraceutical products also available. Naranja algorithm is used for every, not only for herbal and nutraceuticals, but in general use, and it's usual but not to the specific to the herbal products. WHO UMC, Uppsala Monitoring Center uh, is this is the global pharmacovigilance causality. It's applicable to the worldwide and it's also include herbals and nutraceuticals. And the specific tool to the liver injury like hepatotoxicity, it's a scale is then Russell of causality assessment method RUCAM. It's the strongest tool for the herbal hepatotoxicity and it's used in many of the case reports. And the modified WHO herbal criteria is an herbal monitoring consider product for quality and contamination. For contamination product quality, WHO herbal criteria is used. And for hepatotoxicity cases, occasionally in a herbal medicines, these are used. CIOMS is used, scales are used. CIOMS means Council for International Organization of Medical Sciences. These casualty assessment tools are using in herbals and nutraceuticals. These casualty assessment scales are having some questionnaire and some criteria to define that ADR is came from that drug only. They are having some questionnaire, some criteria, some set of questions. By analyzing those questions and by asking through the patient, and we are getting some answers from the patient based on that criteria, we have to mention that ADR stage one or the stage two, or where, how much the ADR is worsened. Based on this criteria, we know all that about ADRs in this D challenge or re challenge. Everything is involved in this. Uh, in Naranja scales also some criteria is there. In Rukhan scales also some questionnaire criteria is available. By using this criteria, we have to know the ADR severity. Next slide, sir. MEDRA. MEDRA is a medical dictionary for regulatory activities. MEDRA regulatory activities is standard international terminology. It's used for the coding and analyzing adverse drug reactions. It includes from the herbal, traditional, and complementary medicines. Means complementary medicines like acupuncture, meditation, or everything other than conventional treatment. Complementary medicines also available. So for everything, MEDRA is coding, analyzing, reporting adverse drug reactions. This is the main thing in pharmacovigilance in ADRs. Medical dictionary for regulatory activities is then standard international terminology. It's used everywhere. And the regulatory agents like WHO, UMC, US FDA, EMA. WHO, UMC for India, US FDA for US, EMA for Europe, and the pharmacovigilance database. It's a BG base, it's the largest world the database, and use MedDRA terms to classify areas regardless of whether the drug is a synthetic drug or herbal drug or a nutraceutical or conventional or complementary or anything. For every drug, regardless of anything, they are analyzing, coding, and reporting the areas. This coding is most important. And in this, some lowest level term, preferred term, high level term, based on that criteria, some flowchart is available. Based on that, they will code the adverse drug reactions. Next slide, sir. These are some case reports I found in literature searching uh, through for the herbal and nutraceutical products. In case one, 52 years old woman developed a acute liver failure. Women get developed a acute liver failure after consuming the high dose of green tea for weight loss. She's used green tea for weight loss daily 3 times. 52 years. Then she developed acute liver failure because of herbal products. And in another example, a patient on warfarin is experiences severe bleeding after starting ginkgo supplement. Ginkgo is showing antiplatelet activity now. Warfarin for prevent the blood clot. Patient is on already warfarin and they are starting ginkgo. Because of both, they got drug interaction and the patient is experienced serious severe bleeding. And another case also, example, third one, a young male bodybuilder developed a renal failure after chronic use of creatine and the protein supplements. They are externally the bodybuilder is taking the supplements. Already our body is producing creatine and to strengthen bones and the bodybuilder taken that creatine and protein supplements because of overload. The bodybuilder get chronic uh, renal failure, acute renal failure he got because of chronic use of the creatine and protein. Because of this overproduction or this over supplementation, also patients get adverse drug reaction. In fourth case, next example, in multiple cases of stroke and sudden cardiac death is linked to the epidural. In many of the cases, most of the cases are reported in on epidural usage, multiple cases. Because of this only, the ephedra was banned in 2004. FDA was banned. In multiple cases, sudden cardiac death was occurred by using the ephedra. Next slide, sir. Here coming to clinical challenges. Many clinical challenges are there in adverse drug reactions for herbal nutraceuticals and conventional medicine also. But here some major clinical challenges I will help. First one is under reporting. Most of the patients that don't know about the reporting. It's under reporting is the major challenge for everyone. The patient often do not disclose the herbal and the supplemental use. And the next, diagnostic difficulty. ADRs may mimic the disease symptoms sometimes. If suppose patient is getting liver toxicity, but patient is having some hepatitis symptoms, because of this confusion also diagnostic difficulty is available. This diagnostic difficulty also leading a challenge nowadays. Due to the polypharmacy is also major challenge. Concomitant use with prescription drugs increase the risk of interaction. Concomitant use means patient is taking multiple medication with prescription medication. Already patient is using prescription medicine and then patient is taking herbal and nutraceuticals. It leads to the drug interactions and it leads to the ADRs. This polypharmacy also major challenge nowadays because of concomitant. Patient is having multiple diseases. Patient is having multiple medicines to their disease to prevent the disease. Patient is having multiple disease and patient is using multiple medication. This also is a major challenge nowadays. And the regulatory gap. Unlike pharmaceuticals, many herbal nutraceuticals escapes rigorous pre-marketing trials. In conventional therapies, first undergo pre-marketing, next pre-marketing trials, and first is clinical trials, pre-marketing, post-marketing. But in herbal products, they are skipping market some trials because of this regulatory gaps also. Many of the people getting ADRs. These four challenges are most important challenges nowadays everyone is facing. Because of the challenges are running in companies. Underreporting is the major challenge, and the polypharmacy is also major challenge because of patients nowadays getting more disease. Next slide, sir. Regulatory and pharmacovigilance perspective, WHO encourage everyone to report the ADRs in pharmacovigilance. It's a drug safety program. Pharmacovigilance system now encourage the reporting of ADRs from supplements also. Regulatory agencies like FDA, EMA, CDSCO monitor adverse reports for supplements. but systems are less stringent when compared to the conventional drugs. There are systems available, but not strict like conventional drugs. Need public awareness and post-marketing surveillance and standard labeling of herbal nutraceuticals is the most important. For post-marketing surveillance is the most important for every drug. To trial a drug in large population, post-marketing surveillance is the most important for every drug. Healthcare professionals should systematically inquire about supplements usage and report the adverse events, adverse effects. Healthcare professionals in hospitals they are looking more areas in patients. So the healthcare professional inquire about that areas is most important, and the need of public awareness is most important for this. Next slide, sir. Strategies to minimize ADRs. Which strategies will minimize the ADRs means patient education is most important nowadays. If patient education is most important for illiterate people. Uh, everyone is for everyone is most important, but illiterate people are more important. Patient education is avoid assume patients are everyone is assuming herbal products and nutraceutical products are natural, and these products are safe. They don't get any ideas. But like conventional drugs, herbal products and nutraceuticals also having ADRs. People are getting ADRs. Patient education is most important. And in healthcare training is also most important for doctors, pharmacists who are working in hospitals, who are located in hospital setting for serving the patient. They are trained in herbal pharmacovigilance, herbal and nutraceutical pharmacovigilance to know more about the herbal products. If suppose our patient is came to the hospital, already the patient is using herbal products, and then now doctor prescribe a prescription medication, conventional therapy. Because of that herbal medicine and this conventional therapy, patient will may lead to the ADRs. So patients, so doctors, pharmacists, nurse, everyone, healthcare professionals should know about the herbal pharmacovigilance. This is most important. And then research. In research, most of the trials are skipping in herbal product. Uh, Compulsory conduct the randomized clinical trials and post-marketing surveillance. Randomized clinical trials to avoid the bias, to standard to do the trials with standard drug. Conduct the randomization is most important for every drug to avoid the bias. And the post-marketing surveillance is most important to test the drug in large population. It's most important for research. It's most important for every drug. And regulatory tightening is also important. Mandatory quality control, standardization, labeling. Labeling of herbal product is some drugs are herbal products are missing labeling. Its labeling is also most important, and quality control also most important, and integration of databases. And nowadays, for conventional therapies, some drug interactions are also some drug interaction checkers available. Like that, use drug help interaction checkers in hospital clinical settings. This will lead to minimize the areas now because of this patient education, healthcare training, research, regulatory tightening, integration of database. Because of all this, patient might get minimize the chances of ADRs. These are some strategies to use in healthcare settings. Because of these strategies, we can minimize the ADRs. Next slide, sir. In future perspective, nowadays AI is more widely used. Everyone, AI in pharmacovigilance. It can detect the areas patterns for herbal and nutraceutical databases directly. Nowadays, AI using in pharmacovigilance, but AI usage in herbal and nutraceutical databases also is most important. It may lead to many people life saving. And the personalized medicines like genetic testing is also most important because of in family history or in some members is having some disease and not and another people don't know, they don't know about that. They need awareness. So genetic testing is predict the susceptibility of drug and interactions also. So pharmacogenomics is most important. It's related to the genetics study. It's personalized medicine, it depends on person. And this blockchain for traceability is the most important nowadays, because this blockchain for traceability is referred to, it's focusing on blockchain technology to create a transparent and a secure and record of a product journey from raw material to the complete consumer, up to the consumer level. So this blockchain traceability will product journey throughout its supply chain from raw material to the end of the consumer. This is the most important. This is the very important to track the herbal supply chain to prevent the adulteration. And if suppose the if implementation of blockchain traceability is it's a major thing. If suppose the implementing this procedure will minimize the ADRs also, because of tracking the drug from the raw material to the end of the consumer. This is the most important for every drug. And this AI is most nowadays using, but AI can directly detect the areas. The herbal and nutraceuticals also is for most important in future perspectives. These points are most important for ADRs. And the overall conclusion of this session, well, next slide, sir. Coming to overall conclusion of this topic, while herbal medicines and nutraceuticals are offer therapeutic potential and health benefits, and they're not risk free, they are giving the benefits, and they are also giving the adverse drug reactions, drug interactions, therapeutic potential health benefits. But ADRs, it having ADRs. ADRs can rise due to the toxicity, interaction, and contamination, adulteration, due to the some adding some elements also. ADRs are ADRs from, if for herbal and nutraceutical products, ADRs are ranging from the gastrointestinal upset to severe organ toxicity. So in some conditions, patient may get died. It's reported worldwide. Many ADRs are in herbal products are reported worldwide. In literature review, I got some information also. I provided that for examples also. ADRs are mostly reported in this, but we have more reporting to the ADRs, but with more awareness. Clinicians and patients and regulatory authorities must adopt the vigilance approach with the reporting, monitoring, and educating to ensure safe use of this product. Safety of the product is most important. So every clinician, patient, regulatory authorities must adopt a pharmacovigilance approach to report the ADRs, to monitor the ADRs, and everyone must educate their healthcare professionals who are working located in the hospital. And the herbal product, where the formulation of herbal product is going on, in that place also pharmacovigilance is most important to minimize the ADRs. If suppose reporting an ADR means, they will ban the drug now. They, most of the people are saving their lives. And strengthening pharmacovigilance and research, regulation, patient education will be a key minimizing risk and ensuring safer integration of herbal nutracycle to healthcare. Final conclusion means, introduce strengthening pharmacovigilance and using good regulatory compliance and a good patient education is most important for minimizing the ADRs in herbals and nutraceuticals. This is an overall conclusion. Thank you, sir. Thank you so much for this wonderful opportunity.
Thank you, Chandana. So we
Welcome,
got
sir.
a couple of questions.
Okay, sir.
So how can we detect ADRs from the nutraceutical if there are considerable, if they are considered natural or safe? How can we actually detect them?
Sir, for nutraceuticals, in clinical trials only, we may get some ADRs. In phase one trials also, we may get some ADRs. In phase two also, we may get some ADRs. In post-marketing surveillance also, we may get some ADRs. By doing clinical trials and implementing more strategies, and by using more technology, we can detect the nutraceuticals ADRs in clinical trials in a large population, post-marketing surveillance also.
And who should be most careful with herbal or nutraceutical use? So, what is your opinion on this? So, like, if you want to reduce the ADRs, who are those people who should be careful?
Patients and doctors, healthcare professionals and patients, because patients
Patients
are
from
overusing
specific
the herbal,
disease.
not specific disease or overall. For every disease, patients are using herbal and nutraceuticals in rural areas. So they must aware of this herbal and nutraceutical adverse drug reactions.
Okay. And what are the simple steps that can actually reduce the side effect risk?
Yes, by some strategies like by using preventive measures, like patient healthcare professional must know about the ADRs, and the patient education is most patient counseling is most important for reducing the ADRs. We have to tell them like use this medication at this time and use this medication at another time. Because of that, same time also patient getting ADRs, and because of lack of clinical trials. More clinical trials, more regulatory complaints, and patient education, patient counseling is most important to reduce the side effects.
Okay. Another question from Anurag is the role of nutraceutical product in prevention and treatment of major diseases like cancer or neurogenerative diseases. I didn't get the
Yes,
question, but
vitamins
maybe
are
he's asked. Yeah, yeah.
vitamins are using in neurodegenerative disease for supporting bone strength. But vitamin D for bone strengthening, like neurogenerative diseases, bone will demineralize. Na? In that conditions, vitamin D or vitamin supplements are using in neurodegenerative cancer disease. But and the
Yeah,
most of
that's
the people
fine.
are using limit. Over or long term usage is not needed, sir.
Okay. What do you think about having product quality and standardization? How much importance do you give about that quality and standardization? Because we are talking about herbals and nutraceuticals. So,
Yeah, sir.
how
I
much
will
does it
tell
matter
by
when you will look at the ADR?
yeah, it's most important, sir, because of the product quality or because of standardization, we can minimize the ADRs. Sir. If suppose the quality of the product is good, patient not get any ADRs. If standardizing with the standard drug means, I mean, we can minimize the ADRs. Now, it's most important, sir. Quality is most important to reduce the ADRs.
Okay, thank you, Chandana. It was nice presentation. So thank
Thank
you
you.
for giving us information about the ADRs, role of the ADRs, and about herbals and nutraceuticals. Thank you.
Thank you, sir. So thank you so much for this opportunity.